15,000 people are living with heart failure, and we know that they are very often being cared for by loved ones who are very often partners of a similar age with the same level of disease profile. However, our evidence on that from other research in this area demonstrates that these carers very often prioritise the person with heart failure's needs above their own, and this really can cause their own health, physical health, to deteriorate, and it can lead to a reduced quality of life and indeed problems with anxiety and depression as they struggle to live with the burden of looking after someone with heart failure. And while a lot of these carers have told us in previous studies that they feel that this is their role and that they are happy to do it, we need to recognise the burden that it presents to them in real life. And we need to then be offering more appropriate services to meet their needs, which will in turn, of course, help them better support the patient who has heart failure. You will be aware that people with advanced heart failure have a similar disease burden and symptom burden of someone with advanced cancer, such as lung cancer, and yet they very rarely receive the palliative or supportive care that someone with a cancer diagnosis will. Therefore, they are very often cared in the community, and when they get an acute exacerbation of their heart failure, they are brought into hospital as an emergency. Very often, our hospitals' ED departments are busy places. They can be kept there for a considerable period of time, and that isn't the ideal environment for someone who is very often old and frail with an advanced disease to be cared for. So what we're really looking at here is going to these patients and their carers and asking them what they want in terms of better support, and then providing an evidence-based intervention that we anticipate will better match their needs. We will evaluate that new intervention, and we will check the satisfaction of the carers with it. And really our end goal here is to, first of all, bring better understanding of these issues into clinical practice and into community care, and also to better equip patients and carers to deal with the severe challenges that they can face